Hello viewers, I'm Dr. Chandra Sekhar. I'm an orthopedic consultant in Care Hospital, Banjara Hills, Hyderabad. Today we shall know a few details about the factors to be considered before somebody considers for a total knee replacement surgery. So as we all know, total knee replacement is a very commonly performed procedure for somebody suffering with end stage arthritis. Before somebody embarks on having this replacement surgery, a few factors need to be considered. First of all, what is the general condition of the patient? Is the patient fit enough to undergo the surgery or not? The clinician will decide whether the patient is the right candidate for a knee replacement, because not every knee pain or knee arthritis would warrant a knee replacement surgery. But for somebody who has end stage arthritis, and if they are facing significant difficulty with performing day-to-day activities, then knee replacement would be a very good option. A general checkup, which includes patient's blood tests, cardiac evaluation, is mandatory before the patient goes for the replacement surgery. So in the blood test, we have to assess what is the patient's hemoglobin level, how the patient's renal parameters are, liver parameters, and the blood coagulation parameters are, and also the patient's blood sugar levels need to be checked. Only if all the blood conditions are at the optimum level and if their cardiac fitness is good, then replacement surgery can be safely performed. Apart from that, there is something called as prehabilitation, where the patient needs to be counseled about exercises to be done before the replacement surgery and post surgery as well. Because a lot of time post surgery, if the rehabilitation is not proper, then the patient may not have a satisfactory outcome. So apart from the general fitness, we have to assess the patient's mental condition and how well they're going to comply with the treatment protocols. Most of the time, there is no need for prolonged immobilization after the replacement surgery, and the good recovery happens if the patient is made to mobilize as soon as possible after the surgery, and a training has to be given about using the walking aids and the knee strengthening exercises post surgery as well. And at the same time, before the surgery, the clinician has to make sure that the patient does not suffer with any infections anywhere else in the body, and the patient fully understands the benefits and the risks and the complications associated with the surgery. Once a comprehensive evaluation is done, and if the surgery can be safely performed to a good standard, the patient is most likely to have a very good outcome following the replacement surgery. Thank you very much.